So prosthetic workflow is very simple. One piece implant, no second stage surgery, bendable neck up to 45-degree. Okay, direct close stage impression you can take. With the screw retained, you can have the option of closed tray as well as the open tray if you want to. Okay, and light occlusion early, as I said to you, either use de-occluded prosthesis or a PMMA prosthesis to be on the safe side when immediate loading, and definitive prosthesis after healing, that is a period of 3 months. Okay.
Yeah. Dr. Gagan, do you advocate immediate loading with these implants?
Yes, I do, sir, immediate loading with these implants.
So, in I am asking
Sir,
like for
that totally depends. Sir, that totally depends upon the torque value. Just as
maybe
in
that is
conventional
okay.
implant.
I got your point, but I am asking you like for immediate loading cases, in how
Mhm.
many days you advocate like for to give permanent processes
Sir,
prosthetic.
preferably you should give them in 3 days. On a
3 days.
scientific basis, if I answer, you have to give within 3 days, because after 3 days, bone remodeling starts.
Yeah, that
Okay,
is what I am
and then
asking.
we should not disturb. But I have delayed it up till 2 weeks.
Up to
I have
that.
done that. It is not advisable. I am not advising that. I am just saying you, I have done that. Don't just take it for that I have said. You can delay it at least 1 week to be on the safe side.
So that means early loading. You had done early loading. Okay. Right. Right.
Okay, for from a scientific point of view, if you are using a rough surface or a hybrid surface, load it within 7 days. That is safe, scientifically proven.
Okay, right. Thank you.
Sir, without rigid fixation,
What's
without rigid fixation,
the full mouth or a single tooth?
both.
So single tooth, we don't need to rigidly fixate that. Okay, and in the full mouth cases, I do rigid fixation. Earlier, I used to do it with the casted or a milled titanium frame, and now I am doing it for the patients that are we doing for the case study for free. In those cases, I am using the intraoral welding. For the cases that are paying me for my clinic's personal cases, for that cases, I am doing that with the frame only.
Okay, sir.
Okay, so we have a strong preference for splinting restorations during the healing phase in the case of full arch restorations.